Hello, my name is Casey Barber, and today the question is anxious chest pain. So, starting off, our question is, while greeting a patient in a waiting room, a physical therapist observes that another patient appears anxious, diaphoretic, and dyspneic. When questioned, the patient reports a recent onset of substernal chest pain and nausea that they attribute to severe indigestion. Which medical condition is most consistent with the patient's clinical presentation? So then we got our four choices. A. Spontaneous pneumothorax. B. Gastroesophageal reflux disease or GERD. C. Myocardial infarction or a heart attack. Or D. A broken rib. So now let's go over some of the answers. So pneumothorax. When you think of pneumothorax, you may think of sharp pain, dyspnea, or trouble breathing. It can be sudden or gradual. It can happen right away, or there can be a slow leak. In rare cases, it can be causing things like dry needling, sometimes in workouts, when people do altitude training. It's normally localized, very localized, because it's a lung, right? There's only one area it's going to be. It's not going to refer to any other. It's not going to refer to any other places. And it's not substernal. Next is GERD, or the gastroesophageal reflux disease. And this one's pretty common. You might deal with this a lot. Or might not. I haven't had too many people come in with these problems, but I'm in more of an orthopedic setting. There is dull pain is a common symptom, so they're just like, oh, it's kind of a burning, dull pain going on. Like I said, burning sensation. They might feel some tightness in their chest, so sometimes people get concerned of a myocardial infarction or heart attack, but really it's just some tightness in the chest due to all the burning and everything going on. And as you can see before, I got a picture underneath here too. Acid reflux, heartburn, hoarseness, bad breath. Hoarseness is from the acid in the esophagus, so that can be a common thing as well. Sometimes it might also cause tonsil pain. Next is a myocardial infarction. So crushing pain, right? Like an elephant on the chest. We've all heard that saying before. As well as some tightness in the chest. Really common symptoms where it radiates into is the left arm. And then it can last greater than 30 minutes. And if it does last greater than 30 minutes, then we should be ruling up a heart attack or myocardial infarction. They might have some anxiety, some dyspnea, trouble breathing, right? Syncope, some nausea, arrhythmias, so their heart might be out of rhythm. So make sure to listen. And then diaphoresis, so they might get really sweaty, which you may attribute to them working out, so you got to be careful. Lastly, a broken rib. So this is something that can be commonly confused with a lot of these. You have sharp or dull pain with breathing, right? Because every time you're moving, that's putting pressure on that rib and those muscles around the rib. Normally sudden onset, pain with twisting or laying on side as well. So whatever side they're laying on, normally is the side the rib's at, right? Because then you're breathing, pushing that into the bed or whatever surface you're laying on, and that's going to cause more pain as well. Let's break it down. Anxious. Well, that was something that we had seen before. Diaphoretic, right? So getting kind of sweaty. And dyspneic. So they are having some breathing issues as well. Their breathing's out of sync. Now, also substernal chest pain, and it's recent, right? And so that means we're kind of ruling out rib, we're ruling out pneumothorax for sure. And then they attribute to severe indigestion. So this is where they're trying to trick you. They're trying to make you think, oh, maybe it is GERD because he's obviously dealt with indigestion before, so it might just be he's having some heartburn. But that is not the case here because the answer is myocardial infarction. So make sure to look out for some of those. You have your anxious right there, diaphoretic, those are good ones, and the dyspneic. Those are all together, and yes, I could see where you could try to mix those in with something else. And they even try to throw you off with the indigestion. But just try to keep in mind and follow what they're looking for because that recent onset is what really kind of throws us off. Thank you for your time, and feel free to like and subscribe if you would, and have a good day.